Welcome back. Penn State Health now has an easier way for you to connect to care. Penn State Health Virtual Primary Care makes it easy for you to access healthcare services from the comfort of your home. Through telemedicine platforms, you can talk with providers and get diagnoses and treatment plans. Here to tell us about how this works is Dr. Christopher LaCoe. He's Vice President of Virtual Care at Penn State Health. When we say virtual primary care, what do we mean?
Yeah, so virtual primary care is just another way to deliver care. It's a fully online family medicine clinic. The only difference from brick and mortar is the fact that the care you receive is actually online as opposed to actually going to the brick and mortar clinic. It's really designed to diagnose and treat a malady, of conditions, chronic illness. Really well suited for patients who have transportation needs, maybe new, moving into the area, having difficulty accessing primary care, and really well suited to manage patients with conditions like diabetes, heart disease, mental health issues, and the like.
Pre-pandemic, for me, the idea of virtual care seemed a little crazy. Like, how can you be treated by a professional without seeing the professional?
Sure.
But it's working. How does it work?
Yeah, so actually in virtual primary care, about 90% of the patient's needs can be handled through an online type of a setup. In certain cases, we need to add some devices, maybe a blood pressure cuff or other biometric types of things. And there's certainly a need from time to come for in-person care. So we're not doing x-rays, for example, online,
right,
or blood work online. But most of the care needs really can be handled through the AV connection and be online. So.
Now, in terms of appointments and insurance, does this work the same way? And then as a patient, do I need anything special at home to be able to do this?
Yeah, I mean, so really the setup is the Penn State Health portal access account. A tablet, an iPhone or other smart device. That enables you to connect with the provider in a secure internet type of connection. Okay. Penn State Health participates with most major insurances, and most of those insurances actually have provisions for telemedicine, and in some cases actually might be a little less costly than going to an in-person clinic. Some payers actually offer a discount for online as opposed to in-person in a clinic. So yeah, lots of different options. The other thing I'd like to say about virtual primary care too is it's not just for episodic needs. You can use it for that, but it really is to establish a relationship with the patient for an ongoing type of care process.
That's a good point. It's not just like, oh, something's wrong.
Right.
It's an ongoing relationship. You also have something, the on-demand app.
Correct.
How does that work? Like, how is that different?
Yeah, that's built for a little bit of a different type of use case, if you will, and that really is for acute care needs, sinusitis, ear infections, maybe rash. It's very portable. It's the download of an app, again on a smartphone or a tablet, pretty portable, and available 24/7, where the virtual primary care offering is only available Monday through Friday, 7A to 7P. The on-demand app is there for 24/7 care and weekends as well.
That's terrific, terrific. And of course, it's cold and flu season, so you're going to probably get more calls. But you can get calls now from anywhere. If you're visiting somebody for Thanksgiving and your child gets sick, you can do it right there.
Right. Yeah. Again, portability is the key with the on-demand app. It's in your pocket once you've enrolled and downloaded the app, set up your account. You essentially can take it anywhere. And we do see a spike over this coming season. Parents traveling with young ones, and lots of success stories of, we just got to the hotel and the fever came and the earache, and we've been able to treat. So it is available throughout the continental United States, 24/7 and weekends included.
So you have these different options for virtual care. What would you say to encourage people to take advantage of it, especially folks who are like me, pre-pandemic, who's like, that's never going to work?
Sure. Yeah, well, first of all, you don't have to be a tech whiz to use a lot of these devices. If you've ever downloaded an app from the App Store, that's enough that, technology, sophistication that you need. So that's one. I think cost is equal, ease of use, and time. To travel for short visits, sit in waiting rooms. I mean, I think those are the things that you hear most positively from patients. Cutting the travel distance, taking time off of work. The other thing that's reported both from providers, our doctors and nurses, and patients is that they oftentimes feel like they have a better experience because it's much more focused, not as many distractions that you would have in the brick and mortar site.
Yeah, that makes perfect sense. Thank you so much.
You're welcome.
Penn State has great options for us. If you would like more information or would like to make a virtual primary care appointment, call 833-774-3627. We'll be right back.